How's it going? Ooh. Anyway, now I've been wanting to make this video for quite a while because I've had a few interactions with people, and sometimes it really does my nuts. so basically, I wanted to make it clear. I wanted to sort of clarify the differences between rheumatoid arthritis and osteoarthritis, because sometimes before I carry on, I suffer from rheumatoid arthritis, which is an autoimmune disease. And sometimes I have a bad day where I might be hobbling along or holding my wrist or something, and I will ask, "Ooh, what's wrong with you?" Probably they're not interested in what's wrong with me, really. They're just more interested in what's wrong with them, and they want you to ask them as well, so they can just blab on about their illness. Anyway, but that's by the by. So, and I go, "Oh, I've got rheumatoid arthritis." They go, "Oh, I got a bit of that in my elbow." I'm like, "No, that's osteoarthritis, you idiot." And I go, "Yeah, duh." "What's up with you?" "Oh, I've got rheumatoid arthritis." "Oh, I got a bit of that on my fingernail." Okay, so I just wanted to clear up and maybe educate some people the differences between the two arthritis. Is that right? Arthritis is? Arthritis is? What's the plural of arthritis? Arthritis is? Arthriti? I don't know. So anyway, let's start with osteoarthritis. Okay, so osteoarthritis is basically wear and tear of the joint. Normally it's the cartilage in the joint gets damaged, and that cartilage is no longer protecting the joint from the bone rubbing against bone. That causes pain and friction, swelling, and don't get me wrong, it's quite painful. Now, what normally causes this, it can be a number of things. Old age, wear and tear, it could be a road traffic injury you've had, or a sports injury where you play in football, rugby, whatever, or in America, soccer, okay? And it could be because you know, if you're obese, obviously that's going to give you more problems with the joints. That can affect the joints, cause osteoarthritis. And it is quite painful, and it's normally treated with painkillers, whatever. And in extreme cases, they may replace the joint with an artificial one. So that's osteoarthritis. And the last thing I want to mention about osteoarthritis is it tends to be limited to maybe one or two joints. Not always, but it's maybe one knee will be affected, one ankle, maybe two knees. But it tends to be, you know, in certain places, not every joint, which is, now I'm going over to rheumatoid arthritis. Now, rheumatoid arthritis is not wear and tear. It's an autoimmune disease, okay? And this is where your immune system thinks, do you know what? I've had enough of fighting bacteria and viruses coming into this body. Can't be bothered with that today. I think I'll go and attack the body itself. So what the immune system does is decide, I'll go and attack the joints. Yay! Hooray for rheumatoid arthritis. So off it goes and starts destroying your joints. Now, with rheumatoid arthritis as well, it doesn't just affect one or two joints. It affects pretty much every joint. So all my joints are affected to a certain degree. My shoulders, my elbows, my wrists, my fingers. I can't make a tight, close fist. Very difficult for me to do. My ankles sometimes, my feet, my toes. Even my jaw at one point. I've had problems with my jaw where I can't bite down. So I have to suck my food for a straw. And that has happened. So it affects pretty much every joint, or it can do. And also as well, you don't just get the pain. There's other symptoms that go along with it. So you get feverish, almost like you've got the flu, and you get this incredible fatigue. And I can't even, only people who suffer with rheumatoid arthritis can describe what this fatigue is like, okay? I mean, I've had it sometimes where I could literally sleep on a bed of nails. I'm like, I go sleep. And you've got to go to sleep. I've been in work and I said to the guys understanding work, I've explained to them. And I said, listen, I've just got to go and have a little bit of a lie down for 20 minutes. Just so I can get through my day. Not all the time, it doesn't happen all the time, but it does. And it can also affect your mood as well. Your mood. Okay? It can affect your mood, make you a bit feel down and depressed, feel a bit sorry for yourself. Play the world's smallest violin. But it doesn't stop there. Oh no, it's not done with me yet. It can also affect your heart, your lungs, your skin, and it can affect your eyes. Now I've had this problem with my eyes. So what happens is it affects your tear ducts. You stop producing tears. Brilliant. Okay. The good thing is, as I'm not a soppy sod, I don't cry at sad movies. Yeah. Always, you know, what's that? Every cloud has a silver lining. Yeah. So what happens is you get really dry eyes. Now tears are important for your eyes to keep them clean. So I ended up having an ulcerated cornea, ulcer on my cornea, and blepharitis in both eyes. And I spent 2 months on steroids and antibiotics trying to get my eyes right. So now what I have to do, I clean my eyes every day with an eye bath and wipe them down with cotton wool. And I take a moisturiser then, almost like a fig tear, and drop them in 3 or 4 times a day, just to keep my eyes nice and moisturised and clean. And another thing it likes to do, so you get these arthritic rheumatoid nodules, okay, all over the body. So little lumps start appearing on your joints. Brilliant. I got a little one on my finger. I don't know if you can see that there. I got one on my elbow, which I show you here. Have a look at that. Okay, I got one on my knee, I got one on my wrist here, and they're popping up all over the place. Brilliant. And lastly, people with rheumatoid disease in general tend to live about 10 years less than someone else. So hopefully, I was going to live to about 120, but now I'm only going to live to 110. There you go. You never know. So what can you do to manage rheumatoid arthritis? With rheumatoid arthritis, you can you go on medication, and I've been on that medication. It is bloody awful, okay? They give you immune suppressants, which obviously suppress your immune system and stops it attacking you. But that can leave you susceptible to other diseases and things like that. But also, it makes you feel bloody awful, and you have to go to the hospital every single month to have a blood test done to make sure that it's not damaging your liver and your kidneys, and your liver and kidney function's okay. So you're really stuck between a rock and a hard place. Do I try and manage my disease, or do I take the medication? Now, I'm never recommending anybody to come off their medication. No, always consult a doctor. I'm no doctor. I'm just a bloke who's saying stuff on YouTube, okay? Don't listen to me. But I've decided to go the other way and manage my disease. And it's working to an extent, okay? I've managed to limit my flare-ups. Obviously, my joints do ache in the morning. It takes a couple of hours for me to be able to move around a little bit. And late at night, I tend to get a little bit achy. I'm a little bit sore now because it was 10:30. But what I try and do, I take cod liver oil every day. I take turmeric and black pepper, okay? Sometimes I will have to take an anti-inflammatory, ibuprofen, if it gets really bad. And I eat clean as possible. So I try to avoid sugary foods, and I try to avoid all processed stuff. Try to eat as clean and healthy as possible. And there has been some good research out, which obviously when you have a vested interest in something, you do a lot of research yourself and look at all these studies. And they're saying that it could be related to the gut. So you've got to keep a healthy gut. So if you process food and sugary foods, the bad bacteria in the gut, they love that. Ooh, thank you very much for that, okay? So you've got to try and limit your processed food and give it what's called, I suppose, prebiotics. So fiber. The good bacteria loves a bit of fiber. Ooh, a bit of fiber, loves it. So give it plenty of foods with fiber in it. And so what I was saying was, so basically what happens is you get what I call leaky gut. So some of the bad bacteria leak from your intestines into your bloodstream, causing this inflammatory response from your immune system to go, ooh, you're having it. okay, and go off and attack you. So by eating as healthy as possible and keeping in good shape, okay, it's going to limit that. You can also take probiotics as well, like a probiotic drink or something, take probiotic foods. But I've also read somewhere now that gluten could make it worse, because obviously gluten can affect a lot of people with gluten intolerance, but it can also affect your gut. So what I'm trying to do now is stop gluten, so anything with wheat in it. And I only just recently started it. I just read this research the other day. The old Google. I'm a doctor now. Yeah. Where's my certificate? So, and I read some quite extensive research into saying that, you know, gluten can help some people with rheumatoid arthritis. Didn't say all, some, you know. So I'm going to give it a go. Okay. Now, I'm not going to be one of these people who tries something out for 3 days and then goes, that's a load of crap, that is. It doesn't work. I did it for 3 whole days and nothing happened. It's going to take weeks, maybe months before I could see a difference. If my gut is leaky, it's got to repair. It's not going to repair in 3 flipping days, is it? Duh. Okay. So I'm going to give that a go. And obviously, I will do an update in maybe 2 months' time to let you know how that went and did it help. So, hey, I'm hopeful. I mean, ultimately, it may come to the point where it gets so bad that I am going to have to go on immune suppressants. At the moment, I'm managing it okay. I get my good days and bad days, but I'm managing it. And I hope it works, because unfortunately, it really affects the amount I can exercise. I mean, I've dropped about 6 kilograms in weight over the last 18 months. That's about 14 pound in weight. And most of that is muscle. And one, because it kind of suppresses your appetite a little bit. And when you exercise, it hurts quite a bit to lift weight. And you feel bad after doing it. So you have to, when you exercise, you can't really go bonkers at it. I still exercise, but I can't do what I used to do. Can't lift heavy weights and things like that. So it's all, and then maybe when I train, it may be 3 or 4 days, maybe 5 days before I can actually train properly again, because I'm like, okay. So I really hope this helps, so I can start training properly again and put some muscle back on. God's sakes, I'm looking like some of my teachers are hanging on me. Anyway, so that's my little informative rant over. So I hope you now know the difference between rheumatoid arthritis and osteoarthritis. And don't ever say to someone with rheumatoid arthritis, I got a bit of that in my elbow. I got a little bit of that in my knee. Yeah. Oh, yeah, boy, Anyway, thanks for watching. I'll catch you in the next video.